Welcome to our Caribbean and African Targeted Health Improvement Program, CAHN Health Hour. The Caribbean and African Health Network, CAHN, along with its national partners, are incredibly pleased to continue to bring to you targeted health and well-being education delivered by Caribbean and African doctors. These health hours are all about empowering, educating, and giving space to Black people so our communities can look after themselves better. Every Saturday, our Black GPs or consultants present on those health and well-being topics that affect you, your family members, and friends. Some weeks will vary and will include other panel members, such as pharmacists, specialist nurses, and faith leaders. Our health hours cover a range of topics and include mental health, heart health, women's health, reproductive and sexual health issues, men's health, respiratory problems, cancer, sickle cell, and many more. We have not forgotten to include within our health hours the many societal, cultural, religious, and racial challenges that can go hand in hand with health problems and influence how we should respond to meet health and well-being needs. The sessions are designed for you, and we want you to use the time to listen, learn, share your experiences, and ask questions to our Black doctors. During every session, we will gather your feedback so we can continue to respond to the needs of our Black community. To request any particular topic, please email health@cahn.org.uk. We encourage you to invite others to our health hour sessions. Spread the word in our community. CAHN is funded by the National Lottery Community Fund.
Good morning, everybody, and welcome to our CAHN programme. This is our we've had probably a couple, 2-3 more sessions before Christmas, so we are going to be doing something slightly different this morning. However, we are going to start with the session on health and wellness. If you've seen the flyer that's been distributed. So thank you to everybody for attending this session. And we look forward to a really productive one where we can hear about health and wellness, but also we can start to think about the feedback that we need to be giving to get ready for 2023. So without further ado, I'm going to introduce Dr. Diana. Dr. Diana, you'll probably know if you've joined us before for future or for programs in the past, where Diana has hosted a number of these health hours. But today we're going to be having Diana present to us on the topic, and we're going to move on to look at some evaluation and feedback, and then we will look at some question and answers in relation to the topic that we've been talking about this morning. So Dr. Diana, I'm going to hand over to you to do your presentation, and then we can come back to myself where we can facilitate a kind of feedback session for the rest of the session. Thank you.
Thank you very much, and good morning to everybody. It's lovely to see you all, and once again, thanks for taking time to join us. So my name is Diana Asante. I am a GP, an NHS GP. I'm proud of that, and I also am the primary care assistant primary care lead for CAHN, and it's an honor to be able to come and present the topic today. So, as Faye said, we are looking at health and wellness today. I'm just trying to get these slides up as we speak. Yeah, so we're looking at health and wellness, and we will be trying to look at a few different areas that we need to think about as we hit Christmas. It's a lovely time of the year, but also a time that we might end up sort of encountering a few challenges if we don't think consciously about them and take steps to mitigate those. So I'm just going to start sharing these slides, and I just need you to let me know whether you can see. Right, so can we see the slides, please?
Not yet.
Not yet, okay, let's see what's going on here. Give me 2 seconds. I'm just going to try this again. So I'll just try closing it completely and then start again to see whether it's going to work. It's always the way, isn't it? Technology would let you down at the last minute. Just give me 2 seconds, please. Right. So just give me 2 seconds. I just need to log off and log back on again. I'm having a slight problem with my computer. So I let Faye carry on while I just get myself sorted. So Faye, do you want to carry on, please, while I get this sorted? Because I think my computer is letting me down a minute. 2 seconds, let's see.
Hi, yeah. Okay. Yeah, so whilst Diana's trying to get the presentation up, so just a little bit about what is happening in terms of CAHN Health Hours. This is something that we are really, really keen to ensure that our communities get the most benefit from. So these health hours, as some of you may know, started back in May 2020. And we were running them really kind of focused in on COVID and getting people healthy and well around that time. And they've kind of blossomed out into a number of different topic areas, particularly areas that are prevalent to our communities. And what we've been trying to do is facilitate through our medics a kind of forum where we can have that education and empowerment, but also to be able to ask questions. That we are very privileged on the Health Hour to have access to our medics to ask them questions. So we really do want to engage you this morning after this presentation around what we see as being really important kind of education that we need to kind of move forward to be as healthy and to be as self-caring and as self-managing as we possibly can. So I think Diana's slides are up now, so yes, we can move on to that section. Okay, thank you, Diana.
Thank you. Thank you so much. And thanks everyone for your patience. And apologies once again. Right, so we'll go straight into the presentation because of time. So we're talking about health and wellness today on our CAHN Health Hour session. And as I said earlier on, we want to just tackle a few areas that are kind of relevant as we approach Christmas. So how do we remain healthy during this session? Winter period is coming up, Christmas is coming up. We're going to start a new year, thank God for that. How do we keep warm? How do we care for our elderly patients? And how do we sort of make ourselves more resilient in this sort of weather? How do we engage with primary care for those who may not know how to do this? I'm sure a lot of us know how to do this. And specifically talking about people in the United Kingdom, we do have the NHS, which we're really grateful for. And then just a really brief update on the various sort of vaccinations that are still ongoing, which people would be eligible for. So what is health and wellness? And we know this age-old WHO definition that says that health is a complete state of physical, mental, social well-being, and not just the absence of disease. So that's something that we're all sort of familiar with. And we know that it's not just not being unwell, but it's also just that holistic health, physically, mentally, socially, all aspects. And then wellness is that sort of active pursuit of activities that, you know, the choices, the lifestyle choices that you make, the conscious effort that we put in so that we achieve that state of holistic health. So just a little diagram there to give us the various facets of, we're thinking of our mental side of things, the physical wellness, our environmental, financial, social, psychological, emotional, spiritual, and all of that comes together. Now, this Christmas, I'm sure that lots of things will be going on in households. People will be eating different kinds of meals and people will be feasting, and whether your sort of table looks like the one on the right or whether it looks like the one on the left, there will be a lot more food than usual in most households, and people will be sort of enjoying this special time of the year, which we are all grateful for. And why are we talking about the impact of health and wellness around this time? We've talked about it throughout the year with all the sessions that CAHN has brought to you through the health hours, through the Healthy Heart sessions on Tuesdays, and all the other sessions. But why are we talking about this at this point in time? Because we know that although it might seem like a very brief season, although it might seem like it's just a few weeks of Christmas or of the festivities, it can have massive impact, either positively or negatively, on various aspects of our health and our well-being. So physically, mentally, financially, emotionally, it can be quite a stressful time. It can be a good time, but it can also be a challenging time. And so that's why we just want to have a little chat about this. So Christmas time is definitely a good time of the year. I mean, personally for me, it's one of the best times of the year. For me, the fact that, you know, the Lord came to save us, it's a great thing for me. And this means a lot to me personally as a Christian. You may or may not be, but it's still a special time for people all over the world. And whether people, you know, are Christians or not, they still identify with this special time of the year where families come together, where people come together and spend time and share and are there for each other. So it is a good time of the year. It's a time, you know, where we show gratitude, where we get together, there's feasting, there's drinking and all sorts. But equally, because of that, people also go slightly overboard, don't we, sometimes? And we might eat more than we usually do, you know, eat things that we don't normally eat the wrong foods, lots of fatty stuff, drink excessively. We may not be as active as we usually are. There might be a lot of sitting around the dinner table, watching movies, doing stuff, opening presents, and not having our usual routines. So our physical health can go out of the window sometimes. It's not all rosy for everyone at Christmas time, unfortunately. And although it's a lovely time, it can also be a sad time for some people. So for some people who've lost their loved ones, or who might be bereaved, or who might be lonely, or for some of the elderly who just don't have anyone, it can be a time of struggle for some people. It can be a difficult time for people, and we must acknowledge this as well and reach out to such people and pray for such people and be there for each other. And it's also an expensive time of the year as well. The financial pressures as parents, you know, buying stuff for kids, as relatives or friends or neighbors, sharing gifts and buying things. Overspending is quite common around this time. Just that stress and pressure of what people have to do to make Christmas the Christmas they want it to be. And certainly this year with a, you know, heating crisis as well, that's another thing that will certainly be on people's minds. Again, talking about other factors around Christmas time, we know that NHS services are typically overstretched at the best of times, but typically in the winter months and around Christmas time, they are seriously overstretched, bursting at the seams. We have less staff on the ground, so not many people who are actually there doing the work, because some people have to take time off, and you know, people have to run a rota and that sort of thing. We still try and provide a full service, but it's clearly not as full as it would be at other times. There's a stretched pressure on social care and social care resources as well. We know that the transport services around that time may not be the regular, you know, bus or train services, and there might be a slightly reduced service. And at the moment, in addition to all this, we are also battling with the public sector strikes. So at this time, I just want to acknowledge all the hard work that our nurses, our paramedics, our post workers, and everyone else does to keep our system going. But equally, when these sectors also go on strike, it does have an impact. So there will be all those dynamics as well happening around this. Another thing that will be impacting our health and wellness around this time will be the increase or the rise in winter illnesses. And so what we find is that these viruses are on the increase. Apart from that, we've got the usual people who might have chronic respiratory diseases. They would have their diseases exacerbated. They will have flare-ups, maybe their asthma or their COPD, people getting pneumonia from different causes. But specifically this year, the viruses that are really affecting the NHS, we've got the flu to battle with, we've got COVID, which is still ongoing, and then we've got the RSV as well, which is also gone rife in most institutions and schools and places. So I just want to very briefly talk about those three things before we move on, just as a little reminder for all of us. First of all, COVID. We've known and heard a lot about COVID, but I just want to sound a note of caution here that the cases are still rising. So let's not be complacent. Caring for ourselves is important. The hand washing that we're used to doing, the sort of sanitizing, the making sure that we're screening and protecting ourselves from spreading those droplet infections is really important because the cases are rising. Yes, the vaccination program has been very successful. Thank God for that. And thanks to the NHS and all the volunteers who've worked so hard. We've had a successful vaccination program here in the UK. We do hear of other countries who have not had such a successful program where cases are really sort of going right through the population. So we can say that over 45 million people have received their first dose, over 42 million people have received their second dose, and over 33 million people have received their booster dose or third dose. And there are even other people who've received further doses depending on their immune status. But nevertheless, there are still hospitalizations and there are still people dying from COVID. So let's not be complacent. Please, let's not be complacent. I want to talk very briefly about flu. So the flu is a virus which we all know about. It's the influenza virus. Every year we know we've got the flu season, which happens in the winter months, and usually we hear about our flu jab, and eligible people have their flu jab given to them. Now, the reason why I just want to talk about flu a little bit is that, again, cases of flu are going up. We're seeing lots of cases of flu. We know that it's a common virus in the winter months. There are different kinds of flu strains, and we do develop vaccines based on the predominant strains. And the symptoms that people will get when they have a flu will be a whole range of symptoms. It's not just a common cold. It can really make people feel very unwell. So fevers, aches and pains, chills, the tiredness, runny nose, stuffy nose, sore throats, just some people even being sick or vomiting, having tummy pain. All of those symptoms can suggest the flu. And it tends to come on really quickly. So very quickly, people become unwell. And within about sort of 1 to 4 days of being exposed, they become very unwell. And then they start manifesting symptoms of the flu. And it can go on for quite a few days and make people feel quite unwell. A lot of the time, a lot of people will recover from the flu. However, the people who are immunocompromised, who have less immunity, who are in at-risk groups, they are the people who would really struggle with the flu. This year, the cases of flu have come in much earlier than we expected. In previous years, we still had the flu, but maybe not as bad as it's come in this year. By mid-October already, there were over 100,000 admissions from the flu. So it's telling us that the cases have started early and the cases are rising, and they are going to continue rising. So for most people, it will be a disease that goes away by itself with no need for treatment. But for a small proportion of people, and in some unfortunate cases, people may go on to develop severe pneumonia, and even sometimes some people end up dying, losing their lives, unfortunately. So when you do get a flu, make sure you're resting, you're keeping warm, you're drinking lots of fluids, you're taking your painkillers, whatever medications over the counter that you need to take. But more importantly, make sure you're maintaining a good health, good hand hygiene, preventing the spread of droplets, sneezing and coughing on each other. And most importantly, have your flu jab so that you don't end up catching the flu. And even if you do, you wouldn't have it as badly as someone who would end up being very unwell with it. So quickly, the eligibility for the flu jab, the 2 to 3 year olds, and then the school-age children, the pregnant women, those who are aged 6 months to under 50 who have clinical risk category. So, you know, things like asthma or COPD or heart disease or diabetes, etc. So you will be called forth to receive your flu jab. If you are in that category, you will be invited. And then our 50 to 64 and over 65s are also in that category. So our elderly patients in the care homes and the nursing homes, residential homes, those who have conditions like cancer or are on treatment that suppresses their immunity, and those who work in the NHS, the frontline staff, they will all be receiving their flu jabs. I've had my flu jab already. I had it together with my COVID booster a few weeks ago. Another one I want to mention very briefly is the RSV, respiratory syncytial virus. So that's another virus which is also causing a lot of trouble at the moment. It's a common virus that causes coughs and colds in the winter months, and it can affect children and adults. But when it does affect children, typically the under 2-year-olds, it causes what we call bronchiolitis, where the little airways in the lungs become inflamed, and then people can't breathe properly, and then there's a collection of fluid in the lungs, and then that leads to serious consequences. So again, it should be a self-limiting disease in most cases. However, in some cases, it can result in people going into hospital, becoming very unwell. And again, the cases are on the rise. So what are the symptoms of RSV? Cold, sneezing, runny nose, blocked nose, cough, fever, you know, the usual stuff. So as we can see, all of these viruses have similar presentation. So COVID will present similar, RSV will present similar, flu will present similar, and all of these are happening around the same time. So we really need to take those preventative measures seriously. When the children, especially the under 2s, when they have severe bronchiolitis, they can end up with more serious symptoms where they become very, very labored in their breathing. They struggle to breathe, and they have these noises that they make when they're breathing. And that is a sign of a child who is seriously or severely unwell. They may not be eating or drinking as much because they're using their energy to breathe, and therefore they don't have as much energy to be able to eat or drink with. And also they're put off their food and drink, they lose their appetite, they become more irritable, more clingy. When you notice these signs, you must speak to a healthcare professional for this child to be assessed, for the right help to be given. If you get to the point where it becomes very, very serious, then we're looking at an emergency situation. And usually these are the babies or the children who have difficulty breathing to the point where they're sucking in between the ribs or underneath the ribs, or there are long pauses in their breathing, or a child who's becoming unresponsive or going pale or blue. That is an emergency. That's the time you need to be calling 999. This child needs to get in ASAP. So the management is similar to most of the viral illnesses: fluids, keep hydrated, the usual paracetamol, ibuprofen. For the blocked nose, we put the drops in them, try and keep the kids upright so that they're able to breathe better, because when they're lying flat, they keep coughing and it's more difficult to breathe, whereas when they're a bit more upright, it's easier. And again, the same message: hand hygiene, washing of hands, sanitizing, minimizing droplet spread. Now, cold weather. So we're talking about also keeping warm in this winter. Keeping warm in the winter, we know that we are all facing the energy crisis, and you know, the extremes of age are more likely to be affected. So the young ones, but also especially our elderly patients as well. And cold can really affect the body. Cold can really affect the body, so it slows down our circulation. It doesn't make us as active as we should be. The blood becomes thicker. It increases the risk of clots. It also increases the risk of breathing and respiratory lung diseases because the cold air that's going in. And also, people are less resilient. They're less able to fight infections. So how are we going to stay warm this winter? How are we going to stay warm? We're talking about our health and our wellness here. Let's dress appropriately. Let's make sure we've got the right clothing to keep warm. Let's keep active so that we are stimulating circulation in our body, and also we're warming ourselves up. Some of our patients, especially our elderly patients, may not necessarily be as mobile as they would want to. Every little bit of movement makes a difference. So even if you can just take a few steps, move around, that is still very important. It makes a massive difference. And those who are completely immobile can wriggle your toes, move your limbs, and relatives can help to sort of move parts of their body to give them a bit of exercise as well. Frequent fluids, as we've said, fluids are very important. Warm blankets these days have become something that are in vogue. In terms of maintaining the temperature in the house, 18 degrees tends to be a figure that's regularly quoted as a right sort of level to try and not go below. So try not to go below 18 degrees. So if you're unable to warm the whole house and you sort of stay in one particular room, because that's quite a common thing I see with some of my elderly patients. Some of them might just be in the living room the whole day because they're not able to go into the other rooms, or they've got to be there until the next care call comes around. So make sure that room is well warmed up to maintain the heat. There is some help from the government with heating bills, as we've heard. Hopefully everyone is going to receive that, and that's help across the board, some small help, but every little helps. There are keep warm schemes and warm home discount schemes that are also available for people to access. They have specific criteria, but people can certainly access those schemes. Age UK is a very useful charity that people can contact if they need extra help. And definitely let's be there for one another. Let's help each other. Keep an eye on your neighbor, keep an eye on your friend, check on those elderly relatives and friends. Now we'll talk quickly about vitamin D. So vitamin D is something that we all know about. Again, CAHN has had various sessions on vitamin D, but just to bring to our attention the fact that in the winter months, we all have less access to vitamin D because mainly we get vitamin D from the sunlight. So the sunlight impact on the skin helps the skin to synthesize vitamin D. That's our primary source of vitamin D. There is some vitamin D in certain foods, but the main source is from the sunlight. So in the winter months, when there isn't enough sunshine, for those who live in the temperate regions, like those of us in the United Kingdom, in the winter months, there will not be enough vitamin D for all of us. So we are all encouraged, and NICE encourages everyone to be taking a vitamin D tablet a day in the winter months, which is the 20 microgram strength if you're an adult, or 800 international units. You can get that over the counter easily to buy. Also, babies and children under the age of 4 are also at risk of having low vitamin D all year round, really, but especially in the winter months. So they can also be supplemented. And then people in specific groups. So there might be particular groups who are more at risk. And we know that those of us with dark skin, so Africans, Caribbeans, South Asians, because of our dark skin, the melanin acts as a shade and it stops the vitamin D being absorbed as much as it should. So we are more at risk or more prone to low vitamin D levels. People who might cover themselves with their clothing from head to toe for cultural reasons. They are also at risk of having low vitamin D levels, and people who stay indoors for prolonged periods of time. So if they rarely go out, or people who are institutionalized or live in residential homes, they don't have enough vitamin D as well. Pregnant women are also in that risk category. And as I said, babies and children up to 4 years old. Right, so we've said a lot, and we'll just swiftly go through the next few slides. So remember that even as we're trying to improve our health and wellness, our physical health is important, our mental health is important, our spiritual health is important, emotional, financial health. So whatever we need to do to maintain that right balance is key. So diet, we've talked about over the months in various health hour sessions, the right food, making sure you're having a balanced diet, you're choosing from a wide range of foods. We're cooking the food properly, so we're not overcooking and destroying the nutrients. We're not over processing food. We're minimizing processed food. We're trying to get as much fresh food as possible. Keeping well hydrated, minimizing alcohol intake, quitting smoking, keeping active, as we've said, that would help us to keep warm, but also help us to maintain a good weight and also help us to have the positive hormones and chemicals that will keep our brain active and also elevate our mood. Exercise is very good for keeping the mood in a good state. Hand hygiene so that we minimize those droplet infections and getting your vaccinations where you are eligible. Let's be charitable to each other. Christmas is a time of giving, but winter can also be a lonely time, a cold time, a challenging time. So let's check on each other. Let's care for each other. Let's minimize waste. Some people may not have, so let's not misuse what we have. Let's spend responsibly so that we don't end up with financial problems at the end of this season. And then just a couple of slides on patient access. So some of us might be aware already that from the 1st of November 2022 in the United Kingdom, patients will automatically have access to their GP records. So those who already are online would have that access, and those who aren't, you can get onto those online apps, to have access to GP records. So this would include the letters, the test results, and even the consultation notes that we put in your notes. So as long as you've got an online account, you're over the age of 16, either via the NHS app or the NHS website or the patient access portal, you should be able to see your notes, see what has happened. It will only show you stuff from the 1st of November. So anything historic, you would have to request via the request of information procedure. And finally, as much as we would try our best to keep well, to do all that we can to be healthy, to look after ourselves, to look after each other, we know that inevitably, as I've said, sometimes people will still end up in hospital, people will still be unwell, people will still have severe illnesses. The NHS is there for you. Let's not misuse it. Let's cherish it, but the NHS is there for all of us. And so in primary care, we've got our GPs and we've got the wider primary care. So that would include the nurse practitioners, the physiotherapists, the mental health practitioners, the practice nurses, the healthcare assistants, and all these other different sort of health professionals. We've even got paramedics in primary care these days who also do assessments, and they all contribute to that wider primary care network that can offer appointments via your GP surgery to patients. There are also extended access appointments. So for people who cannot make the very early morning appointments for people who cannot make the main sort of daytime between the 8 and 6:30 appointments, then we do have the very early morning ones and then the evening appointments as part of general practice, usually offered through the primary care network. But there are appointments, so if you're someone who works and you can't get home till a bit later, then you can speak to your GP to have one of these appointments offered to you, or even appointments at the weekends or in the evenings as well. There's also the out-of-hours service via 111. So that is also GP service, but out of hours, so specifically evenings and overnight, and also overnight at the weekends. And then we've got some community-based secondary care services. So we have admission avoidance or minimizing teams that would visit patients who are very frail and elderly and vulnerable and unwell, but who may not necessarily need to go into hospital, who can be managed in the community. So there are these teams around that can be deployed into such areas as well to help. There are referral systems in place, depending on the nature of one's illness or situation, to see whether there could be respite care provided within the confines of what's available in that particular area. And certainly if things get to an emergency state, we know that we should go to the Accident and Emergency Department or dial 999. So there is help available, and please let's access it. I know that things are stretched, and I know we don't always get the response that we want, but let's not give up. Let's keep trying. If someone is unwell and they need help, get the help as soon as possible, because this winter, as I've said, there are a lot of things going around, and we want to make sure that we keep as healthy as possible. So I will end here, and then we will move on to the next bit. Right. Let's see if I can.
Lovely. Thank you, Dr. Diana, for your presentation. I think it's always a really good one, because you started off with what is health and what is wellness, and looking at how we can actively become well. And all of those components, parts are really, really important. So you've taken us through all of those. So that is really good. Thank you very much. And I think what we're going to do is we're going to go back to Diana's presentation after we've done this next part of the session. But what I need you to do is to hold your questions, put some in the chat box if you have any questions, if you just want to write them down on a piece of paper. But we're going to revisit that and really explore how we can become well. How can we take advantage of some of those services that are available to keep us well through this really trying time as we are in winter, and as Diana said, the cost of living crisis. There's so many things that are impacting upon our well-being at the moment. So let's look at how we can get the most out of those as we kind of, we'll move on to that after this part of the session. So thanks again, Diana, for that. We're going to now talk about or get your feedback around some of the CAHN Health Hours that we've been having. So you may, if you've joined us in the past, you'll know that since the beginning of the year, we've been hosting these health hours on a number of different topics with our partners. You can see them all listed on the bottom. I don't need to mention all the names of the partners. We've been hosting these health hours to bring to you an opportunity to educate and empower, and to give you that opportunity to ask questions to our medics. And we've had a range of medics. We've had consultants, we've had surgeons, we've had GPs, we've had GPs that have got a faith affiliation. We've had a nice combination of different people coming to present over the last 11 to 12 months. So what we want to do now is to give you, our audience, an opportunity to kind of feedback to us about where we're at in terms of meeting your educational and empowerment needs. And when we say about empowerment, what we're trying to do in our community is to look at how we can enable you to self-care, to self-manage, to be the owner of your own health and well-being. So we want to give that information and that education to enable you to do that. So the questions really are we doing that? Are we, is there something that we're missing? Are there gaps in the education or the topics that we have been presenting to you? Is there a way that you want us to package these health hours so they're slightly presented differently? So we want to have this interactive element of the session where we will just kind of ask you to engage with us around that and give us some kind of feedback. So there is a little presentation first of all, and Diana, I think, are you going to go through the presentation slides? Yes. And then we will come back and we'll get you to kind of give us some of that interactive feedback. Okay, thank you, Diana.
Thank you. Yeah, so we'll run through this really quickly. Thanks, Faye, for that. And I know that because of our time, we're trying to crunch in a lot of things today. So we'll go through this really quickly. We just want you to have a look at, the slides as it sort of rolls. This is basically a sort of collation of the topics that we've covered this year from, as it states on the February to November 2022. So a range of topics that we've looked at, broad headings and also sort of isolated areas. But we've covered quite a bit, and we want to know how people feel about this. So starting from the beginning of the year, we sort of went through the discussion about COVID, because that was still quite burning at the time. We've talked about heart disease, we've talked about diabetes, dementia, and specifically vascular dementia and its link to stroke. So that was mainly for the month of February. So we can see that sort of cardiovascular-like theme in that month of February, where we did the diabetes, a bit of the heart and the stroke. Next slide, please. And then in March, we sort of went a bit more into the women's health side of things. We talked about the fibroids, endometriosis, preconception and perinatal, perineal infections, sexual health infections. We talked about pelvic pain and polycystic. So that month was mainly sort of themed around female sort of health and sexual health. Next slide, please. And then in April, we had more of a sort of mental health themed month, where we talked about stress and depression and schizophrenia and psychosis. We had talks on CAMS, post-traumatic stress disorder, and we also had a consultant talk to us about learning disabilities or intellectual disabilities. And so that month was sort of focusing on that. And then in May, we sort of went back more into that diabetes theme, because we realized that based on the feedback, it was a popular program that people wanted to hear a lot more about. So we really dedicated ourselves to diabetes that month, where we talked about the link with high blood pressure, lifestyle, looked at diabetes in pregnancy, looked at different kinds of diabetes and the impact on the various organs, the eyes, the foot, etc. So that was for the month of May. And then in June, we talked a bit about monkeypox, because then we had a bit of the surge around that time. And then we had a varied sort of month in June, with the prostate cancer talk, the skin conditions talk, and then we also talked about lupus and fibromyalgia, relating more to rheumatology side of things. So that was quite a mixed month with all those very useful topics as well. And then we recapped July. We talked about sepsis in July and stress and anxiety, also diabetic eye disease, and we had the anaesthetist to come talk to us about various things relating to anesthesia and preparing for operations. Then in August, so that's August, isn't it? And then we go to September. September, again, we touched on depression again. So you can see that some of the topics have been repeated, because sometimes people want these topics bringing back. Sometimes we feel the need to revisit it as well. We also talked about hysterectomy and had some shared experiences on that one as well. We talked about stroke again, something we had mentioned previously, but brought it back again. And again, hypertension, an all-time sort of favorite important topic. Then we go into October, and being a month of sort of so many things, we were able to touch on breast cancer, we're able to touch on prostate cancer, we're able to talk about cervical cancer and early warning signs. So that was more of a cancer themed month. And we also had a health and lifestyle talk in October. And then just in the month gone, November, excuse me, we've talked about dementia, looking after our kidneys, our spirituality and mental health. And then finally, last week, we talked about stones in the body. And then this week, obviously, we're talking about health and wellness. So we have really tried to cover a wide range of topics. Some of them, we have a running theme, so we can see that, you know, controlling our blood pressure, maintaining good health, minimizing cardiovascular risk factors, like minimizing the risk of getting diabetes and hypertension and heart disease and all of that has run through. But we've also tackled mental health. We've also tackled spiritual health. We've also tackled cancers, and we've also tackled lifestyle side of things, as well as some other rheumatological and skin conditions. So that's kind of a summary of where we are now, isn't it, Faye, and what we've sort of hopefully managed to achieve. And we'd really want to hear from you what people think and how they would want to see things sort of go forward. So carry on, Faye.
Thanks, Dinah. Yeah, just running through that. Gosh, we've covered an awful lot in the last 12 months. But as you say, many of those topics have come back because they are particularly prevalent issues and concerning issues in our community. So we have brought back, as you'll see behind me, there's like a little diagram which has got some conditions that CAHN particularly focuses in on because they are prevalent, and you can see things around CVD, cardiovascular disease, so hypertension and stroke and diabetes. Those things have come back time and time again because we have some real pressing kind of issues to be grappling with, and how do we reduce the prevalence of some of those in our communities, the cancers and, you know, some of those respiratory issues, those ones that Dinah has been through on the slide. So we can see why we're doing some of these topics, but what we need to do now is hear from you in terms of what are we missing? Is there a combination of things that we really, or you want us to be focusing on? So, for example, one of the things that I have mentioned in the past is when I think about mental health and I think about, you know, some of the reasons for the kind of prevalence of mental health. Yes, we can look at it through pregnancy, but we can look at how we can join up some things around prison, you know, people coming out of prison, or the impact of prison on our families, you know, so we could look at mental health and you know, and those effects there. But what we want to do is hear, what do you want to see during 2023 in terms of our topics and focus during that year? So I am going to hand over to yourself. You can put things in the chat box. You can raise your hand as well. We really want you to engage with us. We want to get it right. And what we really want to do as well is to increase the level of involvement from our community. It's so rare to have this opportunity to be in a forum with a doctor for an hour and 15 minutes, being able to hear from them, have that tailored education as well, to make it specific to our community, and to be able to then ask questions so we can actually go about our daily lives doing things that will improve our health and wellness. So over to you. Any questions? Let's have a look in the chat box and see if there's anything there. If you want to raise your hand, please do so if you've got any suggestions for us. We're just going to spend the next sort of 10 minutes doing this before we move on to the question and answer from the presentation. So let's have a look. Okay, discussions on mental health. Okay, so Roy, thank you for that. So and this is where I'm going to ask you to kind of speak up and kind of give us a little bit more information about that. Roy, if you don't mind unmuting yourself. So if we're looking at the manifestations of mental health among friends and family, right, brilliant. Okay then, so rather than just looking at it for yourself, are you talking about looking at it for others as well? Do you want to unmute yourself and just give us a little bit more to go on?
Hi, Faye. Hi,
Thank
Dr.
you.
Diane.
Hello.
Asante. Hi. It's actually in terms of understanding and recognizing possible symptoms of mental health amongst people who you're very, very close to, whether it's friends or family, and working out how to actually manage and how to actually deal with it. So I've got somebody I'm very, very close to who we suspect is going through issues of mental health. She's gone through a particular traumatic period and COVID-19 hasn't helped. And then there's certain levels of delusions that we suspect that she's undertaking, and it's just whether do you work in her delusions, do you challenge her delusions, do you we've been suggesting to her that she needs help, but she refuses to get that help. So it's just how do you actually go about managing and dealing with such individuals?
Roy, thank you. I think that's a great topic. And it is something that we haven't particularly focused on. We focus on what is mental health, you know, and how we manage it, particularly for ourselves, but recognizing what to do for others is really important. And I think I mean, and it's something we're talking about in CAHN as well. We're talking about mental health first aid. How do we become that person that recognises mental health in other people? So let's look at how we can package that and bring that kind of health hour topic to the Saturday sessions. But thank you for that.
Yeah, no problem. It's just a thought. It's just a thought, and I think it's something that's more common than you've really realized, specifically when you've got individuals who are imagining things. We think they're imagining things, but we're not living with them, so we're not there 24/7 to be able to monitor or measure. So what kind of support should we be offering her, other than wrapping them around our hands and giving them as much love and attention as possible? But are there any other things that we should be doing, could be doing? What's the approach?
Yeah, lovely. Thank you, Roy.
Yeah.
Okay, so moving on, the correlation between high blood pressure and erectile dysfunction. That is, interestingly, we have talked about this topic. We need to bring that to you, a very important topic. And we actually did identify someone that's going to be able to deliver that. So definitely, let's look at how we can bring that. Because I think what we tend to do is focus on a lot of women's health as well in CATIP. So I think it'll be really good to bring that to you in 2023. So moving on to some more discussions on cancers. Okay, becoming more prevalent amongst Black communities. Yes, I do think that is something that we need to focus in on more. We did do a whole month on cancers. We did some of the cancers around prostate, not just prostate, but we did cervical, breast cancer, and we do know about the growth in cancer prevalence in our community. So again, yes, let's look at some of those topic areas. I'm just kind of wondering, Nusrat, given you do have a clinical background as well, if you can unmute yourself and tell us, is there anything specific around the cancers you're thinking about for these Saturday sessions?
Hi, Faye. Hi.
Hi, Nusrat.
Yeah, it's just that of late, if I hear any news about the Black community, my friends, my colleagues, most of them are being diagnosed with cancer, and it's quite like the kind of support that you can give to them if you got a relative or a friend in a situation like this, because most of them are still not accepting it, that it's a condition. They think maybe it's a curse from Africa or something like that. I've got so many people around me now suffering with it, and it's quite hectic. So if maybe, and I've been telling them about this thing, so maybe if we go ahead and then discuss a little bit about it, and then create the awareness in our community to let them know that it's there, it's a condition, you can get it no matter. I don't know.
Yeah, no, thank you, Nusrat. No, you're absolutely right. We do need to be raising awareness. We're not immune to these conditions. And I think years gone by, we were not seen to be a community that was more at risk of various cancers. This has grown, and we do need to kind of like bring that awareness to our communities. But I just wonder, is there, other than what we've done already around breast, prostate, cervical, is there anything that you're hearing about or seeing amongst people that you're caring for from the Black community that's growing? Is there any other cancers that we need to be focused in on?
I think you've touched most of them, but if we can do more on breast cancer, that would be great, more on that, because I've got a couple of friends who are still not even getting it, that it's a condition that they've got. They think, some of them think it's a curse from Africa. So it's just that if we can elaborate more on breast cancer, it's going on, then it's quite, yeah.
Yeah, sure. Thank you, Nusrat. Thanks for that. We will, and I think because when we did the session a couple of weeks back on spirituality and health, we brought in some of these issues around some of those beliefs, cultural beliefs, religious beliefs about how and why things happen. So we can kind of mix those topics and bring in and make it very, very relevant to our community. So thank you for that. I can see a hand up before I go on to the next questions in the chat. Nikki. Is that Olenike?
Yes.
Hi, Olenike. Come in with
Yeah.
your comment or
I have,
question.
yeah, I have also put in a chat box about cancers, various types of cancers that we can discuss. And I've put in there like bowel cancer, yeah, and the other parts of the body, because people I've heard about quite a few too suffering from bowel cancer, just as the last speaker said. So if we can take more topics on different parts of the body that can be affected with cancer cells, it will be good too. But absolutely all the topics have been very fantastic. Thank you.
Thank you, Olenike. Thanks for that. Yeah, no, definitely bowel cancer is something that we do need to look at. So yeah, okay then. So we'll give some more focus to cancer and support and awareness raising and those kind of different things. So and also things like, I don't know, Diana, but things like liver cancer as well, because again, that is growing in prevalence, isn't it? Linked to kind of obesity and things like that. So maybe a focus around those as well.
Yes. Yeah, so I completely agree with what the previous speakers have said. I think we can focus on the other cancers a bit more, and we'll try and incorporate that. So that the bowel cancers and maybe the various different parts of the sort of GI tracts, esophageal cancer, stomach cancers, large bowel cancers. We can look at liver and pancreas and all of those other things. So I think there's a lot more that we can probably do with cancers, and hopefully in 2023 we can address that. Yeah. Okay, thanks for all those lovely comments as well. They're really helpful and we're taking notes as well.
Okay, lovely. Okay, so prevention and management of arthritis is another one. Yes, we'll definitely take into account of that. So we have had some of that in 2022, but yeah, let's focus in more. And I just wondered, Ernest, is there anything around that specifically that you think that we need to be kind of focusing in on? If you wanted to unmute yourself, you don't have to. But if you wanted to add anything more to that, just to give us a little bit more steer.
Hello, can you hear me?
Hello, we can hear you. Morning.
Yeah, I'm puzzled. My mother suffered from arthritis and ultimately died because of complications arising from arthritis treatment. I think it's probably the medication she was given. And I am shell-shocked that at the age of 61, and I'm fairly health and wellness conscious, I exercise regularly, I'm beginning to experience, quite some excruciating pains. I've even started using knee braces, to cushion the effects of the pains, especially when I'm exercising. And I'm wondering, what is it that I'm not doing? Or what is it I could do better? And I know I don't want to find myself, deteriorating to this extent which she did. I mean, she lived to, in this part of the world, arrived at the age of 79, but at 61, I'm struggling with my knees already. So I'm very concerned. Okay.
Right. Okay. Lovely. Thank you, Ernest. We will definitely cover that. It's something that my mum keeps on talking about as well. She's, can we have more on arthritis, joint problems and things like that, and how to prevent and manage. So yes, thank you for that. And that is, definitely something that we will focus in on. So please, we will bring that to some of these health hours, because there are things that we can do. So let's look at the prevention and be more, like say, positive and look at how we can stop ourselves ending up in a worse state, so we can help with some of that knowledge. Okay, so just moving on very quickly. Okay, so yes, looking at the fact this is a health hour, and CATIP is particularly about health. I think this is where I was going with some of the combination of the different types of health problems that we suffer because of society, because of some of the things that go on in society. So, for example, I mentioned earlier about mental health in prison. For example, somebody here, another Faye, has mentioned about young people and knife crimes, a really topical and very important issue. And we can combine things like that with mental health or, you know, other things. And I think what we could do with something like this, and this is just another idea, we could have a kind of panel discussion. So we could have the doctor maybe around the mental health element of it. We can have a young person, and we can maybe make it a bit more interesting in those ways, if that's something that would be welcomed by our audience. But certainly, Faye, it's not something that we would kind of ignore, because it's a very relevant and topical issues and very relevant to our communities in particular. So we'll take that on board as well. Okay, so moving on, depression, yes, massive going through the perinatal period, and the mental health issues. We can bring those back, we can focus in on more of those. And just to say as well, please remember that every health hour that we've had has been recorded and sits on our YouTube channel. So please, you know, as we go through 2023 and we've got these topics, just remember that we've had some of these topics before. So if you're going through a problem or an issue or a challenge, please have a look through our archive and have a look and see what our doctors and people recommended during that session. But we can revisit perinatal mental health, a very big problem in our across our communities. Eating disorders we haven't touched on, that's a very good one, so let's bring that to you as well. I'm going really quickly now because we have gone over my little bit of time. IVF, okay, so we've touched on that slightly. That was probably over a year ago now, but let's look at that again. Another challenge to our communities. It doesn't work as well for our communities, so let's bring that back and talk about that. Blood cancer, again, yes, prevalent in our community. Let's focus in on that. This is wonderful because many a time I have to sit there and think about what we need, so this is really helpful for us. Also, first aid training. Okay, Pauline, do you want to give us a little bit more on what you mean by that? If you don't mind unmuting yourself, Pauline.
I recognise that it would be very difficult to teach first aid online, doing particular things, but there are some things I think that could be conveyed online. I'm just thinking in terms of injecting maybe 5 minutes on one particular type of first aid, maybe at the end of a session, not a whole hour, because it'd be too much for people to remember.
Sure. Yeah, thanks, Pauline, for that. So yeah, no, I think it's good to give people some tools to be able to go away and use if you need to use them. So I think we did a session on basic life support. We didn't actually teach, obviously, basic life support online, but we talked about, you know, how to manage. So if you found somebody that had a cardiac arrest, you know, what would you do? So we were giving some of those steps and skills there. So yeah, we can bring some of those first aid you know, bits into what we're actually talking about. So if we're talking about, I don't know, hypertension, or we talked about, there's a number of things where we could actually, I'm seeing now, where we could bring some of those aspects in. So thank you for that, Pauline. Scardosis, okay, yes, we've not covered that, have we, Diana?
I don't think we've done sarcoidosis, no.
No, we haven't. So, okay. And eye health, yes, we we have a session coming up in January, actually, on cataract. So, yes, eye problems and things like diabetes and things like that. And I don't know what's going on, but I'm actually hearing a lot more now about people with eye issues. I don't know about yourself, Diana, but that is becoming a kind of topical issue. So thank you, Valrita, for that. We will have a look and see, you know, where we lie in terms of our community's health around eye disease. But certainly we had glaucoma, we did something around diabetes and eye issues, and we will be doing cataracts, and I'm sure it's in January when we're looking at that. Miscarriages, all of those women's health issues. Yes, lovely. Thank you so much, Nusrat, for those suggestions. We do have in CAHN a Black Women's Forum, and these are the kind of topics that come up requested. We've covered them in the past. We will revisit them. They are issues for our community. So let's keep on revisiting and empowering our communities around that. So there's a long list now. It's getting longer, which is brilliant. We should hopefully have a whole year covered with all of these suggestions. You can keep them coming. So thank you so much for your suggestions. And if there are any things you think, again, would be really helpful in terms of the way that we present some of the sessions. So, for example, we've done some sessions where we've had case studies. Case studies, people like those real life examples of how, you know, it's been somebody taking them through that journey. So we've had people actually coming in sharing their case studies, but we've also had many of our addicts bringing in some of those case study examples about what's worked and what the outcomes have been there as well. So if any suggestions like that about how we should be doing things, panels, case studies, please put those in the chat box. So thank you so much for your contributions. This time, I completely agree, Angela. Let's look at young people. We've not focused in too much on young people. Let's bring that into the discussion. And let's as well try to bring the young people on the platform. What we tend to find on these platforms is that we're very heavily weighted towards the female, very heavy weighted to people in middle age brackets. We want young people on these forums. We want men on these forums. So please do all you can to involve others to actually benefit from these sessions as well. So thank you for that. And I'm not sure whether the survey is going up today, but if it is going up, please as well remember, we're always looking for your feedback about each session. We want to know where people have come from. We just want to be able to target particular areas where we don't have as much engagement. So please do complete those surveys when they do pop up on the screen. Thank you. We're just going to spend the last kind of 5 minutes or so just kind of bringing us back to Dr. Diana's presentation, which was all around health and wellness, and really kind of wanting to focus in on, that active kind of approach to improving our well-being. So we can all strive to be healthy, but actually, what does that mean to you? And how do we gain good health? And the health doesn't mean the same for all of us. It means different things to us all. And Diana, you broke down some of the different kind of components of wellness. So you've talked about, social wellness, spiritual wellness, physical, emotional wellness as well. So really what we're just going to do now is just any questions about that active kind of, those things that we need to do to become well, and especially become well throughout the winter. And my first question, you talked about flu and the importance of having the flu jab, and you talked about the eligibility criteria for having the flu jab. Now, of course, we are in the same territory as we were with COVID and vaccination, and some of the kind of anxieties and questions around taking things like, some of these vaccinations. And I just wonder, how can you encourage us to engage with some of these, you know, there are lots of places now where you can go and have your COVID vaccine, you can have your flu vaccine at the same time. We know from our community we're not engaging very well. What's the best way to engage our community in this? Why should we take the flu vaccine?
Thank you. So thanks for that really useful question. And thanks to everyone who has made a comment or contributed or unmuted themselves and said something or typed something or fed back to us. We really appreciate this. We value it, and we hope to improve on the service that we provide you. So just coming back to that really useful question about why should we have the flu jab? And it's, if we sort of flip it on its head about why not? So why not? So why wouldn't we want to have something that would increase our protection? Why wouldn't we want to have something that would put us in a better fighting place if we were confronted with the flu virus? I know that there are always concerns, and they're very legitimate concerns that we all have one way or another, for whatever reason dear to us, why we may not want the flu jab. I know people who've had the flu jab year in, year out, and one particular year they had it and they were really unwell, and that put them off. I know people who just have reservations about vaccinations in general. But we know that the flu jab is a jab that we've had over and over again, so many years, and we know that it works really well in minimizing the risk of getting severe flu. And by severe flu, as I said in my talk, it means people getting severe pneumonia and people dying. It's as straightforward as that. In the old days, when the flu jabs were not available, flu was wiping people out. Lots of people died from the flu in the old days before the onset of having the vaccine. So now that we've got a vaccine that can increase our protection, that can prime our body, and the flu virus is a very clever one. Every year it's changing, it's coming up with new strains, it's doing something different, which means that you cannot rely on last year's protection. And that's why even the vaccines are formulated early in the year when the predominant strains have been recognized, then a vaccine is put together. So for instance, this year, the one that's formulated is taking into account the H1N1, the H3N2 influenza viruses, because they seem to be quite prevalent at the moment, especially the H3N2. So that's the sort of dynamic study that goes on all the time to make sure that the vaccine is put together to afford us the best protection. Mainly the message is so that you don't end up having severe pneumonia, ending up on a ventilator, or losing your life from something that could have been preventable. So I really hope that this reassures us to have our flu jabs.
But thank you, Dr. Diana. And also you mentioned about the vitamin D as well, and the importance of taking your vitamin D. That's become a lot more kind of pronounced, hasn't it, since COVID? So again, the message around vitamin D, please, just to kind of emphasize what we need to be doing around that.
Yeah, so again, with vitamin D, as we've said, we know that as dark-skinned people, as people who are from Black, African or Caribbean, origin, we have melanin, which is good, which protects our skin from the harmful rays of the sun, but it also blocks our absorption of those rays that would help convert that would produce vitamin D when it hits the skin. So we need a lot more sunlight compared to our Caucasian counterparts to generate the same amount of vitamin D. Vitamin D is good for our immune system. There are still studies ongoing, because at first we used to think it was mainly bone and teeth and sort of joints. But now we're realizing that vitamin D receptors are found in other organs that are not necessarily just relating to bones and teeth. So there's ongoing research and evidence is emerging that it's really useful in modulating the immune system, and even in people who have immune compromised diseases or people who have sort of immune conditions, giving them vitamin D does augment their immune system. So it's really useful for us as we talk about preventing diseases, as we talk about health and wellness, and also for our well-being. When people are low in vitamin D, they feel very tired, they're achy all over, they lack energy, their mood is low, they're lethargic, you really don't want to be in that place. So your 800 micrograms, 800 international units or 20 micrograms once a day to keep your levels up, maintain those levels, eat healthily as well, is what you need to do. And those who are breastfeeding, it's also recommended that you have the vitamin D drops for the babies. Those who are having formula feed, unless they're having more than 500 mils a day in total, then they should also be having vitamin D fortification as well. And it's not just vitamin D that's good for the immune system. Basically, a healthy, balanced diet is the message. But when we talk about vitamins, vitamin C is also very useful for boosting the immune system and fighting infections. Zinc is also very useful. So all those components that we get from eating healthily. Okay, thanks.
Lovely, thank you, Diana, because I was going to ask you how much should we be having, but you've covered that. Thank you. So I'm gonna be wrapping up shortly. Just a couple of comments here. Yeah, Roy, we feel your pain. This question or this comment around access to GPs. We're talking about keeping well and some of the challenges there with accessing. So if we can't get hold of our GP, what do we do? What should we be doing if we really need to engage? And some of the access issues, ask my GP, not all of us can access that. So, what do we do throughout winter when we need to speak to our GP?
Thank you. Thanks, Roy. And you're not being disrespectful at all. You're raising a very valid point. And I can tell you that the frustration is not just for patients, is equally for us doctors and for clinicians as well. It's really, really a difficult situation that we find ourselves in, where literally demand has outstripped supply. We just do not have enough appointments. We just do not have enough hours in the day. We just do not have enough personnel on the ground to meet the needs. So I think that's the real problem. And sometimes it's important for us to be honest and open to you, to say, look, the NHS is struggling, and we put our hand up, we accept, we are struggling, because otherwise people feel that the services are there and they're not being able to get through, they're not being offered it, but actually we are struggling. The NHS is bursting at its seams, and that's the reality on the ground. But coming back to your question, if you can't get hold of you, so basically there are different ways that people can contact their GPs, and different practices are doing slightly different things at the moment depending on the area. So that also probably doesn't help. But generally, you can go into your GP surgery to request an appointment if that's the system that they use. Following COVID, I know that a lot of GP surgeries are using the sort of filling in the e-consult or filling in the online form to get an appointment, or maybe phoning up to be put onto a list and then you get a call back. So that seems to be quite a common system that is being used. So that in itself is a challenge, because sometimes you put yourself on that list and when we call you back, you're not available. It's the one time that you've popped to the loo, haven't waited 4 hours for that phone call, or you try to call and you can't get through. But if you cannot get hold of your GP and you really need to speak to somebody, then you can contact the 111, the out of hours service if it's out of hours. If you cannot get hold of your GP, then you can complete this online form which I'm talking about, because we will pick it up. We are supposed to pick every single online consult that comes in. So we will pick it up and we will deal with it in a timely fashion. And if you cannot get hold of your GP and it is an emergency, then you've got to go to A&E. And so that is what it is. It's either this is something that can wait for your GP to get back to you, or once you've sent in that e-consult or the online form, someone will definitely get back in touch with you. Or if this is something that cannot wait and you've already tried your GP, you've tried 111 and you can't get through to anybody and you need to be seen, then it means you've got to be seen that day. You've got to go to A&E for it. And it's not any easier when people go to A&E. There is a long wait. I've had patients who've gone to A&E, they've sat there for 8 or 9 hours, they've got fed up and they've left and they've come back and tried to contact us the next day. So I'm just really saying that the reality on the ground is that we're struggling, and we really want this to improve for everybody, because we are also patients and we go through exactly the same when we have to access. But I really share your pain, and thanks so much for that comment. It's so important.
Yeah, thank you, Diana and Roy, for your question and comment. This is the last point. I don't know whether, Diana, you can respond to this one, but this is obviously affecting this lady's health and wellness. And Ngozi has mentioned of speaking of moving fingers, and I don't know if it's something you're familiar with, and the pain that's endured through that, the pins and needles. Do you know anything about what may have happened there? I know it's a particular case, an individual case, but anything that you can offer?
Yeah, so thanks, Ngozi, for that question. So you said a family member mentioned that she's got a lot of pins and needles and she can't move them. She's 73. So just briefly, that could be a number of things, Ngozi, but you know, lots of conditions can present with difficulty moving, or stiffness, or pain, or pins and needles. So typically pain and stiffness can relate to things like arthritis. I know our brother Ernest mentioned that he wanted us to do a session on arthritis and joint problems. So we certainly have to have that session, because a lot of people think that arthritis is just wear and tear, osteoarthritis, but there are other kinds of arthritis. There are things like inflammatory arthritis, there are erosive arthritis, the ones that eat up the joints. And I wondered whether Ernest's mum might have had something like an erosive arthritis that eats up the joints, for her to be put on medication that ended up having such, you know, detrimental effects to her health. But Ngozi, it could be things like that. It could be arthritis causing the fingers to be stiff and difficult to move. The pins and needles usually tends to be nerve related. So when people have pins and needles, or numbness, or they have sort of coldness in the hands, or change in sensation, that usually tends to be more related to nerve problems. So it could be that, you know, the joint is inflamed, pinching on a nerve, or a nerve itself is affected. It could also relate to circulation problems. So when people have change in sensation in the hands, or change of color, or that pins and needles feeling in the hands, that could also be related to circulation. So there are a number of things that could be, but that's a really lovely sort of scenario that we could explore further in the arthritis session. And we'll make sure we bring back that session. And just very briefly, I don't know whether you're going to bring another question, Faye, because I just wanted to mention a few things once you're done with that in relation to the previous session.
Yeah, no, I just was going to ask you now if you could just start to wrap up. Any additional information for us, and then we'll hand over to the CAHN member of staff. Thanks, Diana.
Yeah, thank you. So first of all, I want to say a massive thank you to every single person who's come on the Health Hour every single time, wherever you join us from. Thank you so much. Without you, these sessions would not be possible and it will be pointless. I also want to really specifically thank our presenters, our consultants, our GPs, our clinicians who spend time, come on, volunteer their time to give these talks. It's not easy making these presentations. I had a hiccup with my technology this morning, you know, so it's all these things that people have to deal with and outside their busy schedule. So we really say thank you to everyone who's taken their time. Now, just a few things about the topics. So some of the topics that we're requesting to bring back are topics that we've discussed in the past. And as Faye said, if you go on the YouTube channel, you will find a lot of these topics that have been discussed in the past, but we will bring them back because I think it's important that we keep reminding ourselves every now and again, refreshing our knowledge. And sometimes things have changed or moved along a bit, so it'll be really useful to bring back those topics, and we've made a note of them. Talking about the youth, we're beginning to sort of do these podcast sessions as well. So I just wanted to mention that we're having these podcasts, which it started going out already. It's called A Pod with CAHN, and we're beginning to focus as well on, you know, conversations that are not your typical health hour topics. So involving other people, the youth, generic topics. So please listen to these podcasts, share them, and also tune in and listen to our podcast. It's called A Pod with CAHN. Also, I want to say that the lived experiences have really been good, and we would value people sort of volunteering to come on these sessions to discuss your lived experience. I think it just really enriches the sessions, doesn't it, Faye? And it makes it a lot more relatable when people who've been through that can actually share their experiences. But on the topic of health and wellness, I just want to say that even as we go through this season, make sure that you're looking after yourself the best way you can, taking all those preventative measures that you should, and looking out for someone next to you, that neighbor, that friend, that unfortunate person, that vulnerable person. And let's support each other and hold each other up. We can get through this winter together. We will get through this winter together. And next year will be a really good year. Thank you.
Thank you so much, Dr. Diana. Lovely words to end on. And we look forward to that whole new agenda of sessions for 2023. So again, thank you to everybody from me. I'm going to hand over to Percy, who will be closing the health hour for today. Thank you.
Thank you.
Thanks so much. Thanks so much, Dr. Diana. Thanks for that. A slight change of roles for Dr. Diana today, but as always, she delivered the expertly. So thanks for taking us through the topic. And also thanks, Faye, for coordinating that beautifully and the feedback. Lots of things to look forward in terms of next year and what's coming up, both topic and the session delivery. So thanks so much for that. Just to update us on what's coming up, in the immediate future. So next week's health hour similarly will be taking on a very interesting topic. It's on pelvic floor. Okay, the slides are coming up now. Okay, so it's on pelvic floor dysfunction, and we'll have Dr. Loretta In-house to take us through that. So same time next week, Saturday by 11 o'clock. Join us as we go through that. Then another thing we've got on during the week, as always, is our healthy heart programs. So that's more focused on nutrition and lifestyle behavior, really, when it comes to exercises and all that. But for next week's on, it will be focused on alcohol and non-alcoholic beverages, really. So that's one very interesting one to tune into. So it's by 6 o'clock on Tuesday evenings, same time. Please do endeavor to join us for that. Then a couple of services we've got in-house as well that are freely open to everyone, really. So we've got our counseling service, we've got the advocacy service as well. These are free. The contact numbers are on there to access. So please, as much as you can, this is a setup for the community to help and support us, really. And this is from intelligence from our programs like the Healthy Hearts and the helpline, really, that we run, really, and these have been designed to take care of some of our needs, really. So please do feel free to access them. The email addresses there as well as the mobile numbers. And just as we round up, really, just to say massive thanks to all the organizations involved in putting this program together. So we've got CAHN, we've got the Redeem Assembly Christian Church of God down in Sheffield, we've got RAFA, we've got BHI, we've got which is the Black Health Initiative, we've got Croydon BME, and we've got the MFID Caribbean Association as well. And I'm sure, following the topic today, they'll be going ahead and putting their heads together, really, and trying to deliver a more robust package for us in the coming year. So thanks to everyone, and do enjoy the rest of your weekend.
Welcome to our Caribbean and African Targeted Health Improvement Program, CAHN Health Hour. The Caribbean and African Health Network, CAHN, along with its national partners, are incredibly pleased to continue to bring to you targeted health and well-being education delivered by Caribbean and African doctors. These health hours are all about empowering, educating, and giving space to Black people so our communities can look after themselves better. Every Saturday, our Black GPs or consultants present on those health and well-being topics that affect you, your family members, and friends. Some weeks will vary and will include other panel members such as pharmacists, specialist nurses, and faith leaders. Our health hours cover a range of topics and include mental health, heart health, women's health, reproductive and sexual health issues, men's health, respiratory problems, cancer, sickle cell, and many more. We have not forgotten to include within our health hours the many societal, cultural, religious, and racial challenges that can go hand in hand with health problems and influence how we should respond to meet health and well-being needs. The sessions are designed for you, and we want you to use the time to listen, learn, share your experiences, and ask questions to our Black doctors. During every session, we will gather your feedback so we can continue to respond to the needs of our Black community. To request any particular topic, please email at CAHN.org.uk. We encourage you to invite others to our Health Hour sessions. Spread the word in our community. CAHN is funded by the National Lottery Community Fund.